All right, you guys. So, welcome to the class. You probably already saw my intro video. If not, here I am. I'm going to go through the syllabus with you. And I literally just finished. This is like 2 days before class, so this is me procrastinating a little bit more than I'm comfortable with. But I literally just finished the putting the finishing touches, I think, on it. So it's fresh in my mind, and hopefully I can give you all the stuff that you need to know. My goal for you today is that when we get done with this video, that you will understand what it is that you individually need to do to get through this class. It's going to look like I think it's going to look like a confusing mess because that's how I typically set these things up. But as long as you understand what you need to get out of the class and whether you're in person or online and, all the scheduling stuff, that's the goal here. So let's jump into it without further ado. There we go. Okay, so most of this stuff I'm going to let you kind of read through and figure out on your own. Pretty self-explanatory, so I'm not going to really go through like office hours. Just email me, text me, whatever you need to do. And I'm just going to scan through here to make sure I'm not missing anything. I need to talk about the course format. I've gotten a bunch of questions, and most of you, I think, have kind of figured this out by now, but for those of you that are new, this is going to be totally weird and totally new. So there's this thing called high flex, and you're going to hear about high flex format or whatever, and you guys don't really have to care about it too much. Basically what it means is that we're teaching these classes are hybrid, which means online and in person at the same time. So some work online, sometimes in person, but it's flexible, so high flex. What that basically means is that you have an option of whether you want to show up in person. There'll be a little bit of online work, but hopefully not as much. You can stream the class via the WebEx link, which you can see right there at the bottom of this document. There's the WebEx link. It's also going to be on D2L. And then if you don't want to do either of those things, you can just treat it like an online course. What I'm going to do is record the class session with the in-person and streaming folks, and then you can watch the lecture. We'll be doing some presentations. You can watch those, go through the D2L content, and you can treat it just like an online class. If you can't be present during the class time, don't worry about it. You'll get everything you need to know and be able to participate in everything as well. So that's how I've set it up that way. So this is when class will be held if you want to attend. This is actually Mountain Standard Time for those of you who are not here. I probably should have put that in the original, but whatever. There it is. And some other stuff, okay? I'm not going to go through the course description or the goals. Basically what I did to set this class up, because this is a highly specific to rehab class, with a lot of medical stuff in here, I went through the standards for the CRC exam and the content for what we're supposed to be teaching, and I made sure to hit every single one of those points. So we should be getting every single thing that you need in order to be prepared for the CRC exam if you're going to take it. If not, if you're thinking, well, I want to do an NCE exam and be a mental health counselor, there's going to be plenty of relevant stuff. It's going to be relevant, but also I set it up so that you can kind of tailor what you're learning in the class towards the clients that you're going to work with or the jobs that you want to have later. So as I develop these courses, I'm thinking online, in person, who's going to be doing what and where out in the field, and how can we make it useful to you. So even though I tailored it to the content of the CRC exam, and for those people who are doing rehab stuff specifically and want that disability knowledge, it's going to be useful to you mental health folks as well too. If I want things to be relevant. If you've never taken a class from me before, the primary driver of how I want to get this information to you is I want it to be something useful, practical, relevant that you can actually use out in the field. So there's some stuff you can look through there, book, etc. The grading scheme. People love to know about this stuff, and I'm not exactly sure why, except you want to know how you're getting points. I don't want to talk too much about grades right now, except to say that I don't care about grades that much. I try to level all this out so it sort of balances what I want you to know and what format I want you to get it. So I guess I will talk about it a little bit. I have a little quiz at the beginning. It's not so much a quiz, but just an opportunity for you to get to know the book, because there's some stuff in the back of the book that I want you to pick up. The discussions are going to be a big part of the class. They're not going to be quite like discussions that I've had in other classes or that you will have in other classes. They're going to be quick, simple, easy kind of things, but they're going to be important. So there'll be a couple at the beginning that are a little more traditional, where you want to show up, respond once, and then post continue the conversation, post a couple more times to your classmates and sort of follow up with them on what they're talking about and all that stuff. If this is your first class in grad school, then don't worry about too much. I'll be gentle when I grade. But that's a big part of the class. I want you guys to engage with each other. I want to get the in-person students to engage with the online students, and I want us all to be talking about this stuff because we're going to learn about a bunch of things. But that relevance piece that's so important to me and to you guys, I think too, I want you to take the stuff out of the textbook that's just like anatomy and physiology and a lot of medical terminology and say, well, how does this even apply to psychotherapy? How does it apply to vocational work and that kind of thing? So in doing so, we're going to have an opportunity to talk to each other, and that's where we're going to get a lot of this, where a lot of it's going to come out. So that's a big chunk of the class. Yeah, okay, so I'll talk more about those in a little bit. Papers, there's going to be three small ones. They're not big, but just something to shake it up. I don't want to spend every single week in discussion. Some of you like papers, so I want to give you an opportunity to write those. More on that later. The presentation's a big thing. I'll explain that in a little bit. There will be a final exam. I'm not big on final exams. I don't like exams all that much, but I do want to have one so that we can test our knowledge at the end of the semester and kind of see how we're all following along and that kind of thing. But there'll be a lot more on that in the future. And then these reflection quizzes, I'll explain those I'll explain those in a little bit here when I get to it. The one thing I want you to know about grades is there is a section here. Where is it? Grading policy. Where did you go? You probably just watched me pass right by it. Where the heck is it? Oh, right here. Due dates, missed deadlines and stuff. Okay, everybody likes to know about this stuff. If you miss a day or you're past a deadline, if you're like an hour past or whatever, I usually don't mark any points off for that. But if you turn something in the next day, the way I do this is I take off 10%. So if it's a 10-point assignment, you lose 1 point per day. And if you're 10% for each day up to 5 days, so you can lose 50%, but you're always going to have an opportunity to get something back. So if you're like, oh man, I was out for a week, I just got sick or whatever it was, but you still want some points, you can always get 50% of your points back. So if you would have gotten 100, you'd get 50 and you'll still get points there. So most people just want to do this on a one-to-one basis, and I'll explain that later to you guys, but this is kind of where I explain that. Okay, let me go through what these individual assignments are. Actually, no, let me go through the schedule first. I think that'll be easier to understand kind of how we're going to do this. So for week 1, we're just going to have a kind of generic, well, it's not generic, but a get to know you kind of discussion. It's not just an icebreaker because I hate those. Like, what's your name? Where are you from? What's your favorite color? I want to have an actual discussion about this kind of content. So we'll start out with that, but it's going to be light and easy and just sort of share your thoughts and reflect on the prompt. It'll make sense when you get there. The terminology quiz, I call it what the heck is I actually have what the heck is blank. In the back of the book, there's a whole bunch of resources, procedures and what they mean. Latin prefixes and suffixes, which are going to be helpful as we get into a lot of this like medical terminology, and some other stuff that you'll see. And the quiz is not so much like, do you know these things? It's like, are you acquainted with the resources? So when you go into these chapters and there's a whole bunch of stuff that you maybe didn't learn in your undergrad in psychology or whatever you came from, then you'll be able to know what's in the back of the book and you can reference that stuff so you can start putting these pieces together to learn the medical stuff. So it's not a quiz to test your knowledge, it's a quiz so you are aware of your resources. Okay, so that's pretty easy. I'm going to do a basic explanation of chapter 1 and sort of orient us to the course. Below this, you'll see that video too. Okay, and then we're going to have another discussion just to kind of get us ramped up into the semester and get used to the class. I have to be gone for the second half of class that day. I can't remember why. I'm trying to think of why, but there's apparently something important going on that I'm not going to be able to be there. And then these reflection quizzes. Okay, so this is a good time to talk about reflection quizzes. There's going to be one of these pretty much every week of the semester. These are not, if you've been in a class for me before, you know what this is. if you've never had a class with me, which I see a lot of new names on the course list, the reflection quizzes are not quizzes at all. It's a 1-point thing. It's basically a substitute for attendance, and it's asking you and I to have it's asking you to give me some, tell me what's going on in your life. I shouldn't say a conversation, but you can use them for a couple different things. In fact, there's an explanation right up here about what they're for. You can use it to reflect on something that you learned that week that says, this is really interesting to me. This is something I didn't know before, and now I'm kind of just like repeating it in my head so it solidifies and gets stuck there. It's an opportunity for you to say, here's something that didn't work for me. I couldn't hear the audio in the video. I couldn't see people very well. The assignments are confusing or whatever. So you can give me feedback about how you're doing in the course and what's working for you and what isn't. Because that's a really great way for me to not wait for the very end of the semester and then respond to an evaluation, but to say, oh, I can fix that right now. And then I can make sure that you're getting what you need out of the whole course. You can also use it as a way to just de-stress and take 5 minutes out of your life. It's like a 5-minute thing. You can type longer if you want to. It doesn't really matter. But I don't want it to be a long, big, burdensome thing. But you can take 5 minutes out of your life and say, okay, here's what's stressful about this week. I know somebody's listening on the other end. I read every single one of them, so and make comments, and don't always reply to you, but I have this sheet where I keep all of my thoughts about what I need to do differently or who I need to respond to and all that kind of stuff. But you can just say, oh, my kids were so busy this week, and I had to go to this soccer game and that appointment, and all my other classes are taking so much attention, and I didn't get to focus on this as much as I wanted to, blah, blah, blah. But it's just for your emotional well-being, basically, to talk to me about what's going on in life, de-stress, decompress, use it however you want to. So you can repeat the material and like solidify things and comment on it. You can de-stress. You can let me know if there's something that's not working for you, whatever. There's a whole bunch of prompts in there that you can look and see, things to get your mind working, but they're the same every single week. So when you see this, it's just a chance for you to go in and get 1 point to say, I'm showing up, I'm doing my thing. Here's how life is going, that kind of thing. So it's really pretty easy, pretty basic, not time intensive. Some people think, I've heard from one person who says they're really tedious, and why do we have to do those stupid things every week? And I say, well, don't do them then. It's only worth 1 point, so just give up. It's okay. And other people say, man, it was really great to just have that 5 minutes for me. And that's what it is. It's 5 minutes for you. And to know that we're in conversation about how you're growing, how you're learning. You can also ask me questions that seem completely irrelevant, like, hey, I heard in another class this thing, or I really want to figure out this, someone told me this career was an option, or whatever. Like, you can use it for whatever you want, okay? So more on that later if we need to. But take all the liberties to make it what you want it to be, just so you know you can do that. Okay. So starting week 3, that's about when we'll really crash into the good stuff. So we're going to be going through some of these chapters to get acquainted with the book. Whenever you see read chapter 3 and 4, that's the content that I'm going to cover in lecture. So I'm going to go over that stuff, okay? There's going to be a quiz on it. Now, these quizzes are, again, not meant to be super intensive and like you have to read the material and you know the things that are in the book. And like those are the quizzes you've taken your entire life, and they're really annoying, and they stress everybody out and that kind of stuff. So I don't want to do that. What these quizzes are for is for you to know how to use the resource of the book, because this book is long and it's dense and it's dry, and it reads kind of like a reference manual to me more than anything. So you can take the quiz unlimited amount of times. If you get questions wrong, you'll take it again, and it'll only give you the questions that you got wrong so that you can take it as many times to get full credit. That's the whole point. I don't care that you read the book, memorize the crap, put it in your head, and then like be able to regurgitate it 10 minutes later, take a quiz, and then forget it all in a few minutes anyway. What I want you to do is I want you to know what the correct answers are, and then I'm going to use those questions to highlight the things that I think are probably kind of important, so that it's more like you and I are engaging in this, what do I think is important? you go soak in that information, try again if you need to, but then you know what things to focus on. That's the whole idea. So even though it's a quiz, you'll have every opportunity to get full credit in every single one of them. I've set them up that way. So again, it's not a test to make you miserable. It's a test to help us understand what do we need to get out of this that's valuable. That's the whole idea. As you can also see, there are a few chapters to scan, and those scanned chapters have to do with the presentations and the discussions. I'm going to explain that in more detail in a little bit here, I think, in just a few minutes. But basically, you're going to hear from, you'll do a presentation throughout the semester. Most weeks, you'll have a chance to hear from your peers to be a special expert on that particular topic. So I think chapter 5 is on stroke. I'll be covering 3 and 4, which is the nervous system and brain injury. 5 is related to that, it's stroke, and 6 is epilepsy and other conditions of the nervous system. So I'm going to do sort of like the generic lecture overview of that whole content area, and then you guys are going to sign up to do presentations on the specific area like stroke or epilepsy or something. The discussion is, and remember I said there was like a whole bunch of points, this is where I really want to get the have us focus on this stuff a lot. The discussions are going to be you're going to get a chance to ask your peers who are going to be the content experts of stroke or epilepsy or whatever the topic is. And then you'll ask them questions. You can also do things like comment on their presentation and what you think worked and what you think didn't. How do you help them improve and get better? I won't give you points if you're just like, good job, you're so awesome, and like that kind of stuff. But if you say like, you looked really nervous, but then once you got going and you settled in, you got really comfortable. How did it feel to talk about this stuff or whatever, blah, blah, blah. Because there's going to be lots of formats that you can do, you can say, I really appreciated how you wrote that thing or how you talked about that thing or, whatever. You can comment on that. You can also say, I thought stroke was something that had to do with this. What about this other topic? And you can kind of engage them in conversation. And so they'll be part of the discussion as well. So it's really brief. It can be one post per week. So you can be sitting in class and then posting while you're in class. Or you can be online watching the presentation at home and posting in the discussion at the same time. So the idea is that the content quiz should take you all of I don't know, maybe a half hour, maybe an hour as you go through and you start to figure out how they work. It should get quicker. The reflection quiz is 5 minutes, and the presentation and discussion, it shouldn't take you all that long. You're not going to have to come back to the class like many times a week and keep re-engaging. I've done that before, and it just gets really taxing on people's stress level and all that kind of stuff. So I want you to spend a fair amount of time looking through the book and getting familiar with the content. I also want you to hear from me, and I'll present on some of this. Your classmates will present on some of this, and then you can sort of participate in the discussion about the topics and get all the information from the book. I've covered the entire book between me and the stuff that you guys are going to present. So you're going to get a lot of information, but I'm not going to require you to do a whole bunch of explaining this in a paper and talk about it ad nauseum in a discussion post or something like that. So you have the opportunity to soak in a whole bunch of information if you need to, but you also have the opportunity to pick and choose what is going to be necessary for you to do your future work. So I don't want to be overburdensome with the work. I want to give you a lot of opportunity, and I think I've done that here with the way this is all set up. Okay, so more on the presentations in a minute. The papers, there's a few papers just because I wanted to shake it up between presentations and discussions and include a few extra topics that I wanted to cover because I needed to, basically, from the standards, the CRCC standards that I want to make sure we got in some stuff. So we're going to talk about stigma. You'll see the paper prompt on that. I haven't actually written it yet, so I got to get on it. But the sexuality one will be really fun, I think, and the medications one should be good as well, too. So they'll just give us another chance to do things a little bit differently, write these in a little bit different way. These are not going to be tied to the content of any particular week, so I think they should be open in D2L. So if you were like, I really want to get ahead, I'm going to go write that paper and hand it in, you can certainly do that. That way you can sort of fit this to your life a little bit too. Okay, So the rest of it, with the content quizzes, the reflection quizzes, and some presentation discussions, it's going to be basically like rinse, wash, repeat. Once you get settled in after a couple weeks, you'll figure out how this goes, and it should kind of follow a consistent pattern over the semester to help keep you on track. Okay, there is one day I'll highlight that I have to be out for a conference, but basically what I'm going to do is cancel the in-person class and just post my lecture online, and you'll do all the same work that you would normally would, because it's going to be a paper that week. So there won't be any in-class discussion or online discussion. It'll just be like watch the lectures. There'll be no peer presentations that day, so there should be a pretty easy week, I think. Or I shouldn't say easy. You should not miss anything. That's the idea. And then final exam. The final exam will be like a take it once, see how you do. If you followed along throughout the semester, you'll do fine. Most people find that, I think, in my classes, that the final exams are not hard if you show up and do the work. And the way that I do all my exams, like finals exams and midterms and all that kind of stuff, is I literally go through the chapters that you'll be responsible for, and I'm only going to cover the ones that I present on, not your peer chapters, I think. Maybe, but I'll make the questions obvious enough so you know. My whole purpose for that is twofold. One, I want you to be familiar with your resource so you can go through this and say, this is a question about stroke, so I know what chapter to go to find the information. And this book is pretty well organized, so it shouldn't be too much digging. But I want you to know your resource, and then I also want you to know what kinds of questions might come up on an exam like the CRC exam, and so I model my questions after that. And just last December, like a month ago, I participated in a workshop with CRCC to develop cut scores for the actual exam. So I had to go through the entire exam, look at all the questions, rate them, and do a bunch of stuff with it. So I know exactly what's on the test. Not exactly, but I know what the kind of questions are and how they look and that kind of thing. So I'm going to kind of model the final exam on that, more or less. Okay. So that's pretty much it. There's a whole bunch of other stuff in here that I was required to put in here, so it looked consistent with everybody else's, but like, professional conduct, remediation processes, support services if you need them, veteran services, disability services, all that kind of stuff. That's all in here too. Here's the meeting link. I'll post it in a few different places so you have it, because you might need it, I guess. And then the last thing I want to talk about, you won't have this in your version of the syllabus, but this is where I write out like all of the prompts for all the assignments. This is all going to be in D2L. And by the way, let me show you this really quick. In D2L, I've set it up so that, come on, baby, there you are. I've set it up so that every week, everything that you need to do that's in that schedule that I just showed you will be right here. So the second week, we're going to have that discussion. That's right here. Here's the prompt for it. And then your reflection quiz. And those are the only two things that we'll have going on that week. The presentation is how much time we got? 20 minutes. Good. We're on time. The presentation's the big thing that's going to be kind of confusing and kind of difficult to follow along throughout the semester. Okay, so that's one thing I want to spend a little bit of time on. So let's go, actually, instead of going back to the syllabus, let's just go right to here, because this is where, in the first week, here's where I explain how the presentation thing is going to work. And because it's kind of complicated, I'm going to explain it here, and then I'm pretty sure I'll have to talk about it in class. So we'll do that probably like week 1 or 2. And so there'll be more information on it. If I have to post an announcement, for those of you who have never been on D2L before, I'll post things right here in this section, the announcement section, that will kind of give weekly updates if I need to say something that I forgot to say in class or whatever. But for the presentation, here's how this is going to work. So I'm going to present on the chapters that in the syllabus say, read this chapter or whatever, and I'll cover those. All the chapters that say scan these, like remember, why isn't chapter 5 in there? Oh, it is in there. Ugh, it's really annoying when I click on the thing. Okay, chapter 5 is, I don't know why there's a link there, but it's the chapter on stroke. 6 is on epilepsy, and then as you can see, there's a whole bunch of different chapters on specific disorders or diseases or whatever it is. What I want you to do is I want you to present on one of those chapters. I want you to pick one. And then you're going to do a presentation in class. It doesn't have to be super long. I think I talked about that down here. 10 to 15 minutes, something like that. And you're going to just kind of give us the basics of what's in that chapter, what does it mean, what's the condition, and what are sort of the, there are sections in just about every chapter like vocational implications. In other words, how is this going to affect work? How does it affect family relationships? How does it affect a person's sense of self and their own like self-concept, self-esteem, and that kind of stuff? I just want to know about how does this apply to our work? So some of us are going to be rehab counselors and we're going to do this vocational stuff. Some of you are going to become therapists. So someone walks into your office and they said, I've experienced a stroke in my life and it's changed my relationships. That's the kind of stuff that we're going to talk about throughout the semester. Just for sake of example, I had a stroke and now it's really hard for me to get around to the grocery store. So my husband has to help me with the groceries, which changes the roles that we have in our relationships. What are those things? What things change? And that's what I want you guys to present on. You're going to be sort of the resident expert on that condition. I will have, by that time, hopefully I will have read the material. I still haven't finished this book because I just got it a few weeks ago. And it's kind of long if you haven't noticed. I will help out with this stuff, but I want you guys to be kind of the experts, okay? So you're going to do a short presentation. In class, we'll have a little bit of discussion with the people that are in person or streaming, and they can ask you like, what was that all about again? Or how would this affect couple relationships or kids or whatever it might be? We'll have a little discussion on that. And then after that, for the online people who are going to watch this later, they're going to see your presentation and then they're going to go into the online discussion, and I want you guys to also kind of follow along with that. So part of this is preparing your presentation and then following up with your classmates to be kind of the resident expert and give them some answers or facilitate that discussion. I'll be there around to help out with this whole thing too, but I want you guys to take some of this on. Part of the reason I'm doing this is because I want you to get comfortable having a specialty and having a niche of like, this is the unique thing that I know that other people don't. Sometimes it can be easy for us to say, I'm just a student, I don't really know what I'm doing. Or for the first few years of practice, you might be like, I can do just about everything, or maybe nothing or anything. Over time, you'll say, but I really know about teenage girls and eating disorders, or I really know about veteran men who have post-traumatic stress, or I really know about schizophrenia and how it affects people's family relationships or whatever. Like, you'll all become specialists in something. And this is a chance for you to sort of get some practice being the specialist. Also, as you get out in the field, you're going to be gathering information from other people, going to conferences, doing CEU kind of things like continuing education credit stuff. And some of you might say, well, I want to be a trainer. I want to actually share my expertise. I want to have a consulting business where I train this stuff. Or I want to have a Facebook group where I facilitate discussions around this specific topic. Or I'm going to go to conferences and present to my peers because they know me as the expert in whatever. This is a chance to get some of that practice, okay? So anyway, that's a little bit of context, but back to the process of how we're going to do this. Where's the link? I put a link in here. Oh, there it is, right there. Oh gosh. Watch me struggle here for a second. Okay, there's a link to a Google Doc to sign up for this stuff. If you click that link in that assignment, you will have access to this document. And I'm hoping this works. If it doesn't work, I'm screwed. But if it does work, this is going to be great. What I want you to do is I want you to sign up for a specific chapter. You have a couple options here. You can sign up based on what content you want to be an expert on. If you have some prior knowledge, that's great because you'll teach us all things, even me, things that I don't know about this. If you have a specific disorder, you can give your personal experience, and that'd be awesome to have. Or you can say, I'd rather do this at the beginning of the semester and just get it over with because this is like the big project, right? or I'd rather just wait till the end and kind of see how other people do this, and because I'm just not the kind of person that likes to go first. You can do that too. The other option is that you have the ability to work as an individual. If you don't like working in group projects, you can do one by yourself. If you really have some friends in the class or want to meet people or whatever, you can choose to do a group project as well. So go in here and sign up. And if you put your name in here and you're the first one and you're like, I want to work as an individual, you can leave a note here in this last column. I like to work by myself, something like that. Then other people know that, like, maybe I shouldn't sign up for that topic. If we were in an actual classroom together, we could all just like talk to each other and say, I'd like to do this one. Do you want to do it with me? Cool, let's do it. This is the best solution that I could come up with to do this with people here in Billings and wherever you are around the world. We can all do group projects or work as an individual, whatever. If you come along and you say, I would like to do that topic too, but I already see that somebody has signed up for it. What you want to do then is you want to reach out to that person and say, hey, would you mind if we did this as a group project? I have some ideas, or here's my experience, or whatever. I'm going to leave that up to you guys and let you kind of get to know each other, send emails back and forth. If you're not familiar with how to do that, by the way, go to the class list, if it comes up, and then say, hey, Brittany, I'm going to send you an email, and it'll send it through the D2L program here. It won't send it to your university registered email address or anything like that. It'll come through here. So you'll want to kind of keep an eye on that a little bit. But you can communicate with each other. You could also, now that I think about it, I didn't think about this before, but if I were like to work in a group, I would put my personal email address, which that is my personal email address. So if you want to email me at somewhere else, you can do that. You don't have to. But basically, I want you to communicate with each other, find a group, work by yourself, whatever, pick a topic, however you want to do it, but just make sure you get your name on here somewhere, because if you don't have a sign-up name and you don't have a presentation, then you're not going to give one and you won't get points for this. So it's really kind of incumbent upon you to sign up for something. Okay, I think I've covered all of this. For you individually, what you want to know is, I want to get signed up and I want to know how I'm going to do the presentation or what the expectations are. So you'll want to plan this out so that you'll have enough time to do the presentation, know who you're working with, and just know that, like, okay, this is what I need to accomplish throughout the semester. Okay, so I'm going to delete this because this will still be there when you guys show up to it later. Okay, so that's how you sign up for something and communicate with your peers about that. The other part to it, let me get down here to the thing. Okay, so here's all the content. That's the chapters that are available. I think there's the Google Doc. Here's a little bit more explanation. Okay, this chapter, or this paragraph right here, talks about what format the presentation has to be in. So if you're coming here live to Billings and you're in class and you want to do like I'll stand up in front of people and I will just talk for 5 minutes or 10 minutes or whatever, 15 minutes, whatever it is, you can certainly do that. But if you're at home streaming the class, you might have, well, that's kind of the same thing, I guess. You could do a live presentation. But if you're at home and doing this as an online course, you don't necessarily get the opportunity to show up in class. You can certainly do that if you want to, but I want to give lots and lots of freedom for you to share the information in whatever format that you want to. Some of you love presenting in front of people and that's what you want to do. Great. Some of you want to just record something at your kitchen table and that's fine too. Some of you will not be able to stand presenting in front of other people and you don't want to talk to a camera, and so you want to write something or create a Prezi, or you want to do you have the freedom to decide, how am I going to do this? If you have a YouTube channel, like a Gmail account, and you can upload to YouTube, post it to YouTube. If you want to write out a document and include some pictures and that kind of thing, if you're a writer, then do that. That's really okay. I want to give you the opportunity to do this in many different formats. However you think you need to do it, that's great. One of the benefits of working in groups is if you have some person who wants to do a lot of talking but doesn't really want to do the research, then maybe you're the researcher and they're the talker, presenter, or whatever. And so you guys get to work together to figure out, how can I effectively get this information from the textbook to your peers in the class? This also means that as we're having the discussion, if we get a whole bunch of people who are like, I don't want to be on camera, and then we write out like a whole bunch of, people just write out their presentation, and then we post it online a couple weeks later, we're like, oh, but I really don't think I learn as well from people. I'm going to give the feedback to other people that, hey, I would love it if somebody would present, and I'll present if you do, and that kind of thing. So I want us to start saying, how do we effectively share information with each other? Because when you get out in the field, that's what you're going to be doing. So I'm going to give you complete license, I guess within reason. I don't know what those reasons are, but I'm going to give you license to present how you want to and decide what's going to work for you. I will challenge you to stretch yourself as much as possible. I hated presentations and I hated standing in front of people talking. And I didn't know how to talk in front of a camera before I came to work here. But it was something that I learned, and it's become so beneficial to me. So if you say like, I'm just get so nervous talking in front of people or in front of the camera, I feel like an idiot, then challenge yourself to do it anyway, because I promise you, if you take the opportunities to do the things that you're scared of, that the courage that it requires is going to give you so much confidence, and it's going to give you a new skill set, and especially if it's something that other people aren't really good at. That will benefit you. So please challenge yourself as much as you can to do the thing that's uncomfortable, because you're going to be asking clients to do that for many years beyond this. Because I know it's uncomfortable for you to talk to your husband about sex, but hey, let's do it anyway, Or I know it's uncomfortable to stand in front to give a presentation at work, but how can we get over some of that anxiety? I'll tell you a story about how I did it in grad school, and you see where I'm going here? So, PowerPoint, Word document, Prezi, PDF, whatever, recording, whatever. So you don't have to write things down. You don't have to do a recording, but just figure out how you want to do that. Talk to your group mates, figure out how you want to organize it. The one thing I wanted to do that I didn't do is I want to figure out how we can avoid people just sort of leeching off each other. So if you say, I want to work on a group project and do nothing and make other people do all the work, I want the really hard workers to communicate with me somehow, maybe through reflection quizzes or something of like, I really carried the load on this and that loafer did nothing. So, can you grade accordingly? And I'll say, absolutely. I absolutely will. And if you don't like the grade you get, it's going to be highly subjective on a whole bunch of things on how you did. So we can certainly talk about what your grades are and how I gave them to you and stuff. I welcome that kind of conversation. So, okay. I put at the bottom here kind of a checklist because, by the way, the 10 to 15 minute thing, you can go longer, you can take less time. It depends on your format and how you talk and how much discussion we get going and all that kind of stuff. I know I've spent a lot of time talking about this, but hopefully it's kind of clear-ish what you need to do. At the very bottom here, there is kind of a checklist of like, okay, what do I need to do? Like, what are the parts to this project? Sign up for the topic early. Do it as early as you can. That way and you can plan your life around, when am I going to do this? If I need a couple weeks to do some research, if I have to figure out the technology, you just want to know your expectations. And I want to make sure that everybody has the opportunity to cover what we need to cover. Oh yeah, there's one other thing too. All of these topics, I would love for at least one person to cover every single one of them. So it may not work out to do that, but I would love it if we could cover all of them. So if you see one that you're like, I don't even know what that is, and it sounds super boring, but everything else is taken, challenge yourself to do one of those and to try it out. Okay, so sign up for a topic. Discuss with a group about presentation if you're doing a group project. So the next thing you want to do after you sign up is communicate with your peers about it. I'd like you to let me know what you're doing. So just send me an email at least before you present it. Like, I just want to know that you're participating in something, that you have a plan. If there's anything I can do to support you, if you're like, no, dude, I got this. I can do a presentation. It's not a big deal. I'll say, great, go for it. But if you do need to ask me questions about like, how do I even record a thing? Or um, if I do a written thing, do I need to send it to you? And I'll say, yeah, probably, because then I can put it on D2L so other people have access to it, right? Like you want them to have access to these things. So we can communicate about that via email. So send me an email letting me know what you're doing. If you're really on the ball and you're like, okay, it's week 1, I signed up, I talked to my group mates, and here's what we're going to do, and it's not going to be done for 6 weeks, I'll say, great, wonderful. So just be in touch with me, be in touch with your classmates. That's the whole moral of the story there. Um, there is a place in D2L to upload this. Let me go up here to the assignments tab. This is going to look a little different than what you see, probably, but there's a D2L submission here. That's because I just need to give you a grade. And so if you upload, like if you have a PowerPoint, upload that. If you have a Word document, upload that. If you recorded a video and posted a link on YouTube, just like put the link in a Word document and upload that simple thing, whatever. Just anything that shows me this is what you did and this is how I access the content that you actually have. So please upload something to that so I can give you a grade for it, basically. And then last is the follow-up discussion. So after you present for the following week, I want you to check in on D2L pretty frequently, like maybe even once a day or once every other day or something. And I want you to see other people's questions, see the discussion that they're bringing in. So you'll be like, all of your classmates will post once, remember? And you as the resident expert or your group can do this together, a combined effort, can say, oh, that's a really good question, or let me follow up on that, or here, let me tell you what I know about these things, or whatever. You don't need to respond to every single person. You don't need to spend your whole entire week on D2L, like commenting on every single little thing and then follow-ups and then, like, you don't need to go crazy about it, but I do want you to sort of say, I've done my best effort to respond to a few different people at a few different times and really sort of, it's like the Q&A after a presentation. There's always a little period of like, what else do you want to know? And I'm assigning for other people to ask questions and provide feedback. They might provide feedback to you on how you presented, so you're going to want to check in and sort of take in that information too. So that's the follow-up. So I know this is a lot of stuff. Sign up, communicate with me, present your stuff, and then do the discussion afterwards. So you'll have a period of like 2 to 3 weeks maybe that you're going to have a little bit more work, but this is how we're going to each share the load, cover a bunch of ground this semester, and then not overburden you too much in the time when you're not working on the project. Okay, so I think that probably covers just about everything. I'm going to scan through here. I'll go back to the schedule. So if we look at this, the first 2 weeks will be an opportunity for you to kind of get organized, get planned, communicate with other people. If you're going to present first, week 3 will be the time to do that. And then, let's see. And then beyond your presentation time, you just kind of go through the book, do the quizzes, read the material, that kind of stuff. And hopefully that will be enough to cover it. We're going to cover the whole entire text almost, even though it's super long and big. But you're not going to be in charge of all of it, okay? That's kind of the point to this. The other part to this, too, is that I know that this class, because it's heavily focused on rehab counseling stuff, some of you might be thinking, I don't want to work with cancer patients. I don't want to work with people with MS or arthritis or back pain or who are on medications or like just whatever it is. So this might not be the thing that you're really interested in. If you need to like skate through the class and not really do a lot of the work, you can do that here, and that's okay. That's one of those things where lots of professors will say like, you have to love my class and you have to do all the work, and if you don't do it, you're not prepared to go out in the field and blah 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 blah. Well, I try to be a little bit more realistic about that and say this is not going to be everybody's jam, and I understand that. I guarantee you, if you put a little effort into this, you will find this valuable later on, because even if you're like, I'm just going to do talk therapy and that's all, you're going to run into somebody who has cystic fibrosis or a son who has it or something like that, and you're going to be like, I know how to deal with this because I know what that does to relationships. I know what that does to a person's self-confidence. I know what that does to a person's desire in their 20s to have kids or whatever it is, like that kind of stuff. It's going to benefit you and it will help you, but you will have the opportunity to pick and choose what things you want to focus on, what things you want to cover, what things you want to be really good at, that kind of thing, so that you don't have to do it all, because that's just unreasonable. But we are going to cover a lot. So okay, I think that's pretty much it. Usually these things go for about an hour, and I think I did a good job of covering it all. So pat on the back, me. Um, I will talk about this same video on the first week of class. So if you're like, I don't really understand the thing, I'll talk about this. Well, it'll be Thursday now, so just coming up in a couple days. We'll cover the syllabus again in class in person so that everybody gets it. So if you're we won't cover it as thoroughly probably, but I'll answer a bunch of questions. So if you guys have questions, I will be there to answer them. And then this is one other thing I can tell you too before I go. This is the first time I've taught this class, and I just finished developing it, like putting it all together and writing up the assignments and all that kind of stuff. So there might be things that are a little bit quirky and like don't really make sense for us. So please feel free to give me feedback on that kind of stuff, because it's only going to make it work better for you, more applicable to your life and your future work. It's going to make the experience of going through the class a little better. So if like, Aaron, you really put us through the ringer here with all the work that you gave us, I'll be like, sorry, let's fix it. You know what I mean? So feel free to comment on like, this isn't working for me, this is working for me, great, whatever. And I will respond to that stuff, because I want this to be as quickly as possible. I want it refined so that it gets you guys the stuff that you want or need to know. Okay, I think that's it for now. I will see many of you in class in a little bit, and for those of you who are online, I won't see you for a while, if ever. That's how these online classes work. But the more that you can be in touch with me, and the more I get to see your assignments and your work and that kind of stuff, the more we'll get to know each other. So I will sign off now, and I will talk to you guys in a little bit. All right, bye.